Hello friends, I am Dr. Preeti Sharma, vascular and endovascular surgeon at Renova Group of Hospitals. Today I am going to talk about something which is called as deep vein thrombosis. Now, as I have been telling repeatedly in earlier videos also, there is a blood vessel called as vein which takes blood back to the heart for cleaning. Now these veins usually which are starting in the legs, the deep veins can form clot, and that clot can be devastating if it travels to the lung and can cause some not so good or an unfortunate event in which patient can lose life. But it is not necessary that all patients with DVTs will have a pulmonary embolism and will have a bad course. So what do we do when somebody is being diagnosed as a DVT? First, I would like to tell how would you know whether you have it or not, or whether you should go to a doctor. If your legs are swollen suddenly, they become painful, they become red, you are not able to take any 4-5 steps in which it is excruciating pain. You have some breathing problem, like even if you are sitting, you feel that you are breathless, or by just walking for 4-5 steps, you feel you are breathless, then it is an alarming sign, it is a red flag sign that you should immediately consult your vascular surgeon. Now, the vascular surgeon will evaluate, will do some Doppler scans and will find out the extent of the clot in terms of the clot is only restricted to your veins or it has gone into the lungs and then it is causing pressure on your heart, and which is not right because it might be fatal. Treatment options are, if it is only limited to below your knee level veins, then we can dissolve the clot by giving some injections and some tablets orally. If it is an extensive clot causing massive swelling of the leg, it is very tender, then usually hospital admission and some form of treatment intervention procedure in terms of sucking the clot and at the same time putting some medicine to dissolve the clot, which is called as thrombolysis, and suction using an angiojet suction or some way in which the clot is sucked. At the same time, some medicine is put to dissolve the clot, so that will relieve the burden of the clot in the veins and will give better results. If that clot has gone to our lungs, then again the clot is being sucked and same thrombolysis is been done. At times during this procedure, we recommend or we make it mandatory that the patient needs something like an IVC filter, so that when we are just sucking the clots in the legs and the clot has not gone into the lungs, in the process of sucking it should not further go into the lungs. So all patients who are experiencing swelling in the legs, pain in the legs, or had a very long journey and that has aggravated their swelling should consult a vascular surgeon and should rule out if there is any possibility to have a deep vein thrombosis. Thank you very much.